In this video, we will discuss: what is a thyroid panel test? A thyroid panel usually includes the following: thyroid stimulating hormone test, T3 test, T4 test, thyroid peroxidase antibody. TSH stands for thyroid stimulating hormone. Other names for the test: thyrotropin. TSH. A TSH test is a blood test that measures TSH in your blood. The pituitary gland makes thyroid-stimulating hormones. The thyroid is shaped like a butterfly and is located below the brain and behind the cavities. The thyroid gland produces hormones that regulate body functions. Hyperthyroidism. In cases where the thyroid organ is not creating enough thyroid hormones, it is called hyperthyroidism. It is also known as underactive thyroid or high hyperthyroidism. Symptoms of hyperthyroidism: hair loss, weight gain, low tolerance, weakness, depressed, dry skin. Hyperthyroidism. Hyperthyroidism is caused by the thyroid glands producing many hormones called thyroxines. It is also known as an overactive thyroid or low hyperthyroidism. Symptoms of hyperthyroidism: weight loss, puffiness, nervousness, tremors in the hands, expanded pulse, swelling of the eyes, trouble resting. Why do I need it? Your doctor may recommend the TSH test if your child has signs and symptoms of hyperthyroidism and hyperthyroidism. When your child is being treated for thyroid disorders, his or her doctor may order a TSH test on a routine basis. TSH test range or levels. Range: 0.4 to 4.0 mul is normal. Higher than 4.0 mul mean you probably have hyperthyroidism. TSH range in pregnancy. TSH range in children. What is the T3 test? Another name for T3 is triiodothyronine. T3 is also another hormone produced by the gland. The T3 hormone is bonded to protein. A T3 test determines the amount of triiodothyronine in your bloodstream. Your doctor can recommend a T3 test if you have signs and symptoms of thyroid issues. Symptoms of thyroid disorders. The following are signs and symptoms of thyroid disorders: fatigue, weakness, weight gain, sleeping issues, dry skin, heart rate issues. T3 test range. Range: 100 to 200. Unit: ing ml. Result: normal. T3 levels will be higher in pregnant women. Patients with liver disease. Ing. DL equals nanograms per deciliter. T4 test. Another name for the T4 test is thyroxine disorder. A T4 test measures the blood level in your body and is an active form of thyroid hormone. A thyroxine test helps diagnose thyroid problems. The thyroid hormone is a hormone called thyroxine. Thyroxine is also called T4. The T4 test is used to check the functions of the thyroid organs. Forms of T4. There are two forms of the T4 test. T4 free. T4 total. T4 free. The T4 test is the test that measures the only thyroxine that is not connected to proteins. T4 total. The total T4 test is the test that measures the total amount of thyroxine in your bloodstream. T4 test range.
Thyroid peroxidase. Other names for the test: thyroid peroxidase antibody, TPO, antibody TPO, TSI. TPO is a practical test to diagnose thyroid issues in men and women. Thyroid peroxidase is an enzyme that helps create thyroid hormones. The thyroid peroxidase test determines if you have antibodies against TPO in your bloodstream. Your primary care physician or doctor may advise a TPO test if you are pregnant and have a weak immune system. Thyroid antibodies. The following are significant thyroid antibodies: TPO, thyroid peroxidase antibodies; TSH, thyroid stimulating hormone; anti-TG, antithyroglobulin. TPO test range.